I think I shall be communicating today in English because as I guess the audience will be a mixed population with a mixed vernacular. So today, as we all know, that it's an important day. It is a muscular dystrophy day, the DMD, Duchenne's muscular dystrophy. Now, in general, this type of disease like muscular dystrophy is a neurological disease which is acquired through heredity. Most of them, not all, but most of them. And Duchenne muscular dystrophy is one of the classical forms which is hereditary acquired. Now, as we all know that there are 46 chromosomes in the human cell, out of which there are 2 chromosomes which are known as sex chromosomes, one of which comes from the maternal and one from the paternal side. And this particular type of dystrophy is one which comes from genetic mutation from the maternal side. As such, I will discuss a bit more about its genetics for you all to understand, for medical as well as non-medical people who are listening to this. Now, what happens? Actually, this is a disease affecting our motor system. Motor system means the skeletal muscles, the muscles which make us move our limbs, help us talk, help us walk. These are the muscles which are known as skeletal muscles. And there are other groups of muscles which are internal muscles which makes the intestine moves, which makes the heart pump. These are known as smooth muscles. Usually muscular dystrophy doesn't affect the smooth muscles, it affects the skeletal muscles. But in this particular type of muscular dystrophy like Duchenne or another variant very similar to this and closely linked also is Becker's muscular dystrophy, which also affects smooth muscle and mainly the smooth muscles of the heart. So usually the child presents in the first decade, that is about 4th or 5th year of age, and the mother and the parents see that while the child was previously walking or running normally, is now suddenly slowing down or becoming fatigued, and it's becoming difficult for the child to run or to walk. He is starting to limp, maybe he is having falls, and also if he sits now, it is difficult for him without a support to get up, or even if he wants to comb his hair or do activities which require movement of his arms against gravity, it becomes difficult for him. So these are the first preliminary observations which the mother notices and takes the child to a doctor. And on examination, it is being seen that these muscles are affected, but nothing of the sensory system or nothing of the involuntary muscles are affected. For example, the child doesn't complain of any pain, of any burning sensation or this, that, which happens in other diseases of the nerves, which involves both sensory and motor. So this is a purely motor, and for example, the child doesn't have any problem in passing urine or holding urine or passing motions. So no problem with urination or defecation. So purely a motor disease. And then on examination, it is being seen that some of his muscles at this stage, that is to start with, are a bit thicker, which we in our terms call hypertrophy. So usually these are the calf muscles, and the mother notices that the calves of this baby or this child is a bit abnormally swollen up. And this is the first stage when the muscles are starting to be getting destroyed. And then at a later stage, these muscles become more and more atrophic or less in bulk. And finally, of course, it is very difficult for the child not only to perform motor activity, but also to sit up from the lying down position, and that's so pathetic that the child is even unable to take his own turns in the bed. That's a very advanced stage that we are talking about. But initially, this is the stage where the mother takes the child to the doctor. And here the doctor will take the proper history and find out that a very strong genetic association is over there. So it is now seen that the child has acquired this from his maternal side. So in a sense, the mother is the carrier and she will transmit this gene so that all sons born to her will be affected by this disease and none of the daughters will be affected. But all these daughters will carry on with this gene and will pass on to their progeny. So this is about the genetics in brief. Now what are the special things? I will come to the management part straight away, which is of importance to you all people who are handling patients of Duchenne's and in their home. So the initial, of course, is by medical management, and initially when the muscles are starting to be affected, this is the right time to start the child on steroids, and there has been several studies all throughout the world that has been shown definitely that steroids do help, and initially there are certain types of steroids which are being used. Their side effects should be monitored, like for example the side effects on the bones. Bones become more brittle, etc. And side effects metabolically, like the child gets fatter, gains weight, then the child may have disturbances in his blood pressure. The blood pressure may be a bit higher than the approximate age of the child. Sometimes the sugars level may also fluctuate, it can go high. So these are the things which are to be explained to the parents and which are to be kept an eye on. And now it has been seen that with steroids for a certain period of time, say about 6 months or so, the child starts showing a bit of improvement in the motor activities. The duration of continuation of steroid definitely depends on the persistent effects of steroids on the child, and has to be decided by the clinician who is giving it. Other than steroids, for example, if the child has already received vaccination, it is fine. But if he has to yet receive certain booster doses, then it has to be really thought about whether those vaccines are active vaccines, there are certain vaccines which are killed vaccines or which are toxins, derived from the toxins. They have no problems, but which are active vaccines, they like live attenuated bacteria, etc., for tuberculosis, etc. Like those are certain vaccines which cannot be given in this child because the child is already on steroids and the level of immunity is coming down. So if a person is on steroids, the immunity status comes down and the person is prone to infections now and then. So this is about vaccination, but the important vaccine which has to be given is to prevent pneumonias from happening, and pneumonia vaccine is mandatory for the child, and it can be given even if the child is on steroids. All the more because how does this disease end up with? Now ultimately, of course, the child is beyond the scope of any medical management, and the child starts relentlessly worsening to an extent that he becomes bedbound. And all the bed-bound complications now take over. For example, bed sores, urinary tract infection, recurrent aspirations causing pneumonias, these things. And another important issue which has to be definitely kept in mind right from the beginning is the involvement of the heart. Because this is a particular muscular dystrophy which affects the heart, an evaluation initially of the cardiac status of the patient has to be done, and time to time repeated, say every 6 monthly or so, by an echocardiogram, and ultimately the child may land up with a heart failure, a massive heart failure which can be terminating. So to prevent that, to improve the muscle contraction of the heart, there are certain medicines which are used, and those has to be clinically decided by the person, by the doctor who is seeing the child right from the beginning. At the later stage of the disease, of course, the child develops problems in feeding, and so the nutritional levels fall in this child. And then of course there are issues like aspirations, like the child cannot properly swallow because of the involvement of the throat muscles, skeletal muscles once again, and the child tends to pass on its food instead of the food pipe to the windpipe, and so recurrent aspirations and pneumonia. So keeping an eye on pneumonias, keeping an eye on the heart failure, keeping an eye on bed sores, on recurrent infections either of the lungs or of the urine. These are the things which are essential in the later on management of the child, so that if these are prevented, then of course the life expectancy can be improved, and of course the quality of life also can be improved in the patient. It is a common belief, and it has been come through experience and through literature, that this particular type of children, they do not see their birthdays in their second decade. That is, if the disease starts in the first decade of their life, they can maximally survive up to their age of 20 or so, after which they don't. But again, all said and done, the maximum age of patient recorded in this particular age was 57, and an average of about 27 years is expected, provided of course the things go gradually, like initial steroids, time to time assessment of cardiac function, assessment of the nature of the infections like respiratory or urinary tract, assessment of the bed sores, keeping an eye on nutrition. These are all essential things. Now, one thing is important, that the child should always be supplemented with calcium and vitamin D, because these are the things which will go down in the child, not only with steroids, but also with prolonged immobility. So those has to be kept in mind. Another important issue is maintaining a proper nutrition in this child. So importance of micronutrients, minerals and vitamins, these have to be taken care of. So an integrated approach by the clinician, the neurologist, of course to a certain extent to keep the psyche of the patient, the help of a psychiatrist if need be, of a nutritionist or a dietitian, and of a pulmonologist, of a cardiologist. These are all essentials, and the teamwork is complete only if this child is monitored in such a kind of center where there is scope of these multiple faculties. Or even if a clinician is vigilant enough, then from time to time the child is taken under care of these particular types of doctors which I told you about. And all said and done, keep your hope, keep the hope of the child, keep the psyche of the child happy so that he doesn't give up and he can have a normal quality of his education. Although it is very rarely seen that these patients or patients may have difficulty in their learning capabilities, but it is rare. Usually the brain is intact. So it all has to go on, like a teamwork, like kind of things which you are right now doing, self-help groups and all. So keep the morale of the child up, and of course by the time that things have beyond your control, and at the end point, of course, you must have to think about keeping on the nutrition of this patient. So if need be, by artificial methods like putting in a tube in the stomach, which is known as PEG tube, or by maintaining the respiration, so relevant physiotherapy right from the beginning, including breathing exercises, is essential. But at the time, if at the end of it this doesn't work out, then of course to improve the respiration of the patient, nebulization support at home, suctioning out the phlegm from the throat at home, and then checking the saturations at home and maintaining it by oxygen, domiciliary oxygen. But of course, all said and done, the child may land up with a process called tracheostomy, where a tube is put inside the throat so that the child's breathing is helped by that. And of course, not wanting that the child will ultimately land up in a ventilatory support. So for all you patients, all you moms and dads who are here right now with their children who have not been so lucky enough to have a normal life, I would say that don't give up. Yes, we are there to help you, and don't give up. There are institutions to help you, like the one from which I am telling you right now, Fortis Group of International Hospitals. And we are always there at your one tickle from your home, and we will be definitely of your service. Of course, we want your morale up, and we want you to pass on this information with all of which, whatever I told you right now, to several people, to such people who are affected, not to give up. We are fighting a battle, and definitely we will win at the end. Wish you all good luck, and wish you all a very happy day today. Thank you very much.